Hello, I'm Dr. Ian Billinghurst, your host for the Raw and Natural Feeding Summit. It gives me great pleasure to introduce our next expert guest speaker, Dr. Emily Stein. Let me warn you right now, you're about to hear the most amazing presentation from a most amazing lady. You'll never think about your dog or cat's mouth the same way after you've listened to Dr. Stein. Dr. Emily Stein holds a Ph.D. in microbiology from the University of California at Berkeley. It was here she studied inter and intracellular signaling pathways. These pathways are involved in stress response and community development in bacteria. Dr. Stein received her BS in microbiology and immunology at the University of Iowa. This is where she studied the interaction between Mycobacterium tuberculosis, TB, and innate immune cells. Dr. Emily Stein founded Primal Health, TEEF for Life in 2017. Her aim is to focus on improving the dental health of both humans and animals by producing oral microbiome modulation products. Now, Emily has spent 12 years at Primal Therapies, Inc., developing a technology called SMMRT. I'll say that again, a technology called SMMRT. This stands for Selective Microbial Metabolism Regulation Technology. Selective Microbial Metabolism Regulation Technology, or SMMRT. Remember that. This technology is focused on using metabolic influences to re-engineer disease-causing bacterial biofilms. Now, this is very important. She's re-engineering these bacterial biofilms with this technology. And she's re-engineering them into those sort of biofilms that are health-promoting. They decrease inflammation and they certainly improve health outcomes. You're going to find this presentation eye-opening, to say the least. So please join with me and welcome and thank Dr. Emily Stein as she speaks about a natural approach to improving the oral microbiome.
Hi, I'm Emily Stein, here to chat about a natural approach to improving the oral microbiome. A little bit about me. My doctorate from the University of California, Berkeley was actually in microbial biology, where I studied how microbes respond in concert together to survive nutrient stress and exposure to heavy metals, antibiotics, and antiseptics. And then I pursued a postdoctoral fellowship at Stanford in rheumatology and immunology, where I focused on the neuroendocrine immune axis and chronic inflammatory diseases like rheumatoid arthritis, lupus, and multiple sclerosis. And interestingly, there's a heavy microbial influence in those disease states. But I'm here to talk about dental disease, which I've been focusing on for the last 13 years of my career. Just a little bit about the epidemiology of dental disease. It afflicts up to 80% of dogs. We're seeing them actually younger and younger, showing signs, at least at one or two sites, of early stage gingival inflammation, not due to tissue injury. It's actually true inflammation. So be aware of that. The increase in incidence is also being seen in the raw fed animals. So if you have a mouth and you're a mammal, you're not immune to dental disease, despite what best intentions. And interestingly, cats, age 3, 70% of them have signs of dental disease, stomatitis or gum disease, which increases to 92% by the age of around 7 to 8. So it's a near epidemic. I call it a severe epidemic proportion. The disease strongly correlates with carbohydrate-rich diets and with dental care neglect. And so I can go into a little bit of that later. And believe it or not, it is an infectious disease that drives the inflammatory process. So it can be spread within households and with direct contact with dental pathogens, particularly in older or stressed or highly anxious animals, or those that have received a course of antibiotics. So we need to be thoughtful about exposure to dental pathogens and the microbiome of the setting for the animal's care and well-being. So just first off, dental disease is not just located in the mouth. It is known to spread to organ tissues. So both the microbes and the inflammatory cells can translocate through the soft tissue into the vasculature and can be tested for in remote organ tissues such as the kidney, the cardiovascular system, and even in joints. On the human side, cardiovascular disease, arthritis, and various organ inflammatory diseases are definitively linked to periodontal disease, and we're seeing the same epidemiologic occurrences in animals as well. So in training, we're always taught that, tooth decay is really a sugar-driven disease in humans. A lot of dogs luckily have very strong, robust enamel, so they often don't get cavities unless they chip a tooth or break a tooth. Some of the highly inbred breeds and small dogs can actually get some cavities, so be aware of that. But really, where gum disease initiates is not a plaque and tartar on teeth problem. It's actually way below the gum line. Even in deep in the alveolar bone of the jaw, there's microbes that co-developed in the womb because no body tissue is sterile. And they co-developed with the fetuses. And so there is microbes impregnated into all bones and soft tissue. So just be mindful of that when you think really about what gum disease is. It's really below the gum line. It's not at all above the tooth surface. Some of the myths are that, like I just mentioned, is that gum disease is caused by tooth plaque or tartar. Gum disease often occurs before accumulation of significant burden of thick tooth plaque or tartar, which is demonstrated in this greyhound. That's usually the last sign of severe gum disease, but you can see how inflamed that soft tissue is and how unhealthy the tissue really is. It does really correlate. This disease state does correlate with the activity of the microbes that actually live deep below that gum line. And we know this, dogs or cats or humans can have no visible signs of visible plaque or any tartar buildup and still have gum disease. It's actually surprisingly more common than I would like to see. Another myth is that gum disease is treatable with tooth cleanings. So cleaning teeth is a great thing. It reduces the global burden. As a microbiologist, just to be honest, it probably reduces the total burden of the microbe content or biofilm in that mouth by maybe 1/26th. There are that many microbes in the mouth. We're talking, it's the second most diverse and most robust compartment compared to the colon. So it's 10 to the 12th microbes in the mouth, and you maybe removed, a couple 100 million. So tooth cleanings don't necessarily treat gum disease. They help manage gum disease. They should be done on a fairly regular basis, but it's not curative. And the reason is that gum disease is actually it winds up being an inflammatory chronic disease of the soft tissue that's really driven by the oral microbiome or the biofilm, particularly subgingivally, where no dental probe can really go down. And so that's why mechanical root planing and scaling isn't curative. It manages the disease state, but doesn't effectively treat. We see within several weeks after root planing and scaling, you can see inflammatory disease signals come right back up. But the problem is, which is depicted in this canine, is that the tissue is just severely eroded already. So it really is a recession issue, erosion of that gingival barrier that really does protect the animal from invasion of microbes inhabiting their mouth. So the reality is that the oral microbiome really does dictate the health status of a pet. And so what I'm going to do for the rest of the talk is just start to introduce you to some really important features of what's called dysbiosis, which is how that oral microbiome, which is all the microbes that inhabit the oral cavity, how they change over time with age and particularly with diet. So 5 key aspects of the oral microbiome is that it really is an organ. Think about it as it's the puppeteer and we are the we're just the puppets. They secrete neurotransmitters, they modulate the immune system, they eat first and secrete waste products, and some of them are toxic that we then ingest all night long while we're sleeping and all day long when we're working or playing or, in my dog's case, playing or napping right now. It's an extremely diverse microbial community, which is important because that's healthful. You see narrowing of that diversity in dental disease, which is the loss of diversity. And it's demonstrably stable. So even upon a challenge with probiotics, which, all your sites are occupied. So the throat probiotics just kind of go right through. They don't really have the ability to even lock in and take occupancy in the biofilm or on the tissue. Or in the presence of antibiotics, you're stripping away transiently some of that biofilm. Interestingly, what we're finding is that, you can have a multi-dog, you can have litter mates grown up in the same household, living in the same household, and they'll still have a different oral microbiome. So it's unique as a fingerprint. And what we do know in utero is it participates in development of the fetus, metabolism in utero, and as puppies and kittens as they age, and in basic and important aging physiology. So dental disease, and this is a complicated slide, but just to let you know, there's a lot of factors contributing to dental disease. But what's really important is what the myth is that you want to remove biofilm or biofilm is bad, but there actually is healthy plaque that you need to have growing in the mouth. And that healthy plaque is usually driven by the microbes that are beneficial, diverse community that are working in symbiosis with their host tissue but they're kept at a low level. So healthy plaque actually self-limits. It doesn't grow chunky and thick. It actually grows in a thin film, coats every surface of the mouth, tongue, roof of the mouth, cheeks, below the gum line, everywhere. And so that regulates the immune system. Now, once you creep into gingivitis, which is the first signs of inflammation of the gingiva, which is usually right around the barrier with the tooth and the gum surface, you're going to see accumulation of higher biomass of that thicker plaque. You're going to start to see a lot of dental disease associated microbes popping up. And you're going to start seeing a recruitment of those immune cells. A little bit of wounding, which is bleeding gums, which is the first sign, just like leaky gut, you have leaky gums because the mouth is the first portal of the GI tract, right? So it's the front of the gut. And we often don't think about that. But leaky gums are just as deleterious, if not worse, than leaky gut. And then periodontal disease is the soft tissue part where you get such a recruitment of inflammatory cells. They start attacking the tissue. You get the periodontal ligament, which holds the tooth in place, winds up just completely getting blown apart by the immune system. The microbes do contribute to that, but it really is what we're considering almost an autoimmune-like disease now these days in rheumatology. So just to mention, everybody thinks that, dogs' mouths and humans' mouths and cats' mouths are entirely different. Actually, no. There is diversity from the same species. The difference is really in the abundance of let's see, actinobacteria versus proteos for dogs. So dogs and cats tend to be led with proteobacteria, tend to have fuso less. Humans tend to have a little bit more fuso in their mouths and less proteobacteria in a healthy mouth. But really, we have a lot of the same microbes and a lot of the same players. It's just the different layers in that roster. And it's really important to focus on the health of dogs and cats and prevention because this disease, once it starts, like I mentioned, is an immune mediated disease process. So it's you really don't want to get that runaway freight train of inflammation started. So early stage healthful prevention is what I'm going to talk about next. So dental disease is entirely preventable. As you guys know, in this the raw community diet, the key thing though, which we fall into practice because, my dog is raw fed too, is keeping that diet diverse, eliminating all the carbohydrates. But diversity encourages diversity in the mouth, encourages diversity in the gut, lower gut. And we know that diversity equals better outcomes generally in pets and people. And daily hygiene practices are actually critical for both humans, dogs, and cats. And I know it's difficult, but really the at-home component of dental hygiene is critical because if you have unhealthful disease-promoting microbes that are secreting toxins or causing inflammation, Really, you got to contain that as early as possible. And in the best and honest way we see doing that is daily. And there are products and practices that can be easily deployed, which I'll present in a minute, that are keys to prevention and or maintenance. And then the most important feature for at home, I think, is routine oral exams. So teaching pet parents exactly how to look at gingival health. What is gingival health? What does that look like? Educating them and then doing routines, getting everybody one sense of what that baseline for that animal looks like, and particularly getting periodic, more frequent dental cleanings for vulnerable breeds that's independent of diet, and for high risk or anesthetic intolerant or high risk, disease states that just don't lend themselves to anesthetic dental cleanings. Any way you can do just quick dental cleanings in the vet office is the best way to go, minimizing damage. So anytime you see a red blood cell, microbes go inside the tissue, inside the bloodstream, and can cause problems elsewhere. So be very mindful about being gentle during those dental cleanings. So really, I want to change gears. Why nutrition is so important for maintaining health of the oral microbiome and preventing a lot of the dental problems is really because we found that it's not necessarily which of the microbes are there, except for there's some really key exceptions, but it's actually what the microbes are eating and secreting that are driving the process. So in this example, there are, polysaccharides, which are fillers often, starches, simpler carbohydrates are now being used a lot in treats and dental products on the market. Dental chews, particularly, are a big problem. And what they do to the microbiome, how the microbes react to that is they are fast food sources. But the problem is when microbes ferment sugars, they spew out acids. And those acids are very, very tough, not only on the enamel, which is dangerous for smaller dogs, but particularly really good at causing epithelial barriers to literally blow apart. And you get transient leaky gums. It might not associate with bleeding, but they are leaky enough to allow microbes to go through. So what we're really, what associates with a healthy mouth are protein-rich diets for cats and for dogs. This is stuff you guys already know, but the reason why is because you get a lot of production of ammonium and nitrites, and those things are really associated with maintenance of healthy epithelial barrier function, regulation of healthy immune cycles. So it really makes a normal immune and anti-inflammatory kind of reaction, and it's enamel safe. And I'm just going to quickly introduce you to one of the real problems and drivers, which is what you want to minimize in dogs. We've seen dogs with like 80% of their measurable content being this little guy, Porphyromonas, and it spews out these little, and you can see this electron micrograph of these little vesicles that just bubble up off of its membrane. And those fuse with our gingival tissue and modify the tissue. This little microbe, it in and of itself is capable of completely invading gingival cells and spread cell to cell. Been demonstrated to be present in the carotid artery of patients with atherosclerosis. We think that's one of the causatives. It's also present in canines and human brains with postmortem testing for dementia. So this microbe can spread from the mouth. It's highly inflammatory, and it is fed actually by the waste products of sugar. So if there's sugar in any diet, any dental chew, anything, bone marrow has a tiny amount of sugar, even for instance, if you do bones, there's always going to be a little bit of sugar present. Peptis and streptococcus are going to immediately churn out that acid waste product, which then feeds Porphyromonas. And then the host also does its digestion down into the gut. And then over time, that sugar penetrates the gut, enters the bloodstream, and gets fed back into the crevicular fluid for another round of feeding. So you always have to think about identifying what's in food, which is why you absolutely want to eliminate, if you can, eliminate these. Even animal meal is filler with some animal bits and pieces stuck into it, ground into it, and different kinds of carbohydrates are not entering into chews or treats like sweet potato. Everybody I know likes to give their dog sweet potato. And while that's okay for gut health, it's not okay for dental health. Chickpeas, pea protein still has some carbohydrate lingering. Oats, fruit. A lot of people, will think about a banana or different kinds of fruits and be very careful. The fructose and sucrose content in fruit is insane. If you do it like every few weeks, not every few times a week. Be very mindful. Also, just to kind of address some false truths in the market, there have been dental guidelines for disease prevention. We're always taught brush your dog's or cat's teeth. And all of our questionnaires that we've gone out now over 3 years, and 250 questionnaires is a little bit underselling it. But honestly, less than about 2 to 3% of dog owners brush their dog's teeth regularly enough. And in cat owners, we're seeing it's like less than 1%. But in the human side, human clinical data, all the meta-analyses of over 5,000 clinical studies done on brushing, there's honestly no statistical effect at improving gum disease, which is not plaque and tartar, it's gum disease. And the few papers that have been published on the human side about dietary pressure, which is diet, there is actually measurable, strong statistical effects at improvement of gum disease states in humans. So I'm really here to kind of educate about, I feel like the best methods, the best practice would be like a mechanical combination with a bully, or instead of a toy, that should be a toy, a chew toy, plus nutrient pressure. So the thing I like about chew toys, they're plush, so it kind of just stimulates the gum tissue. Same with bully sticks. You want them kind of soft, not too hard, because again, you're really trying to be gentle with the gum tissues. And oftentimes these femurs that they're giving dogs are really strong compared to the strength of a dog's tooth, which is much less strong than the femur of a cow, and so be very mindful that you can get chipped teeth and cavities that way, particularly with antlers as well. And then with the bully, it's great. They adjust it. They love it. And then with the chew toy, they chew it and then you can throw it in the washing machine to clean it. And then that nutrient pressure really is there to drive the microbiome. And the key thing is also to remind clients to wash their water bowls and food bowls regularly with soap and water, throw them in the dishwasher. That biofilm from their mouth winds up populating those food dishes on a daily basis. So it is a daily struggle. Okay, so dental guidelines for disease prevention. So regular oral health assessment. You remember I mentioned prevention. Get to know that dog. The pet parents or cat. Pet parents are going to be the best at establishing what baseline looks like and noticeable changes, but they have to get in the practice of looking at that gum tissue monthly, and they need to actually keep detailed records at home. So it might be interesting, especially if, small headed dogs or small mouthed dogs or short nosed dogs of the bully type need extra attention. They get a lot of postnasal drip, plus they were not vaginally birthed, so they don't get coated in the right microbiome anyways, and they have a lot of problems with oral disease rates. Also, examining on a very regular basis, looking for oral lesions and broken teeth needs to be looked at. And I think advising pet parents to do that on a regular basis when their dogs are taking a nap, or if they can possibly, that'll catch problems early. And then doing soft tissue exams, super important, because for vets, they only get to see their clients, every 3 months at the most frequently, 6 months, 12 months or longer. So it's really hard to remember what baseline looks like. So keep detailed records. And then understand that even though, raw fed dogs and cats can still develop dental disease because it really requires a diverse diet, which is oftentimes difficult for raw fed to achieve. So for current practices on dental health assessment, the visual health, the strength of like just using your eyeballs to check out and palpate the tissue, make sure there's adequate gum or circulation going to the gum tissue, make sure it's not orange or inflamed or puffy or receding. It's super easy, low cost, fast way to do it. It does require some training. It is a little bit subjective. But then working with the pet parents who they just have to learn what their pet's baseline is. And as soon as you get a rescue, that's the first thing I would recommend in a puppy as well. And then the problem we use radiography so much, we lean on that so much to diagnose dental disease. But the problem is By the time you see that stage 3 or stage 4, it's too late. The runaway freight train's already out of the station. You can't slow it down. It's basically that tooth is gone. And every time you pull that tooth, you're decreasing the lifespan of the animal. And we know this from human and animal epidemiology data. So it is the awesome thing is, radiography is low cost and you've already invested in the equipment. The weakness is really not sensitive at all for very early stage disease because the inflammation has not yet taken out some of that bone tissue. And it does require baseline. And for particularly rescues, it makes it really difficult because you're just seeing that snapshot and it's hard to relate back into a fictitious time. So it's tough. It's tough. But good thing is folks like us and other groups are working on diagnostics and using both molecular and protein-based biomarkers for testing so that we can monitor and look for signs of change that might show up in the human world. We're seeing 3 years ahead of time before disease occurs. Obviously, that's going to be different for our pets, but we're working on identifying what those risk markers are and where they set within disease onset. And that's really important because, again, I said on the human side, it's pretty well established now, periodontal disease is an autoimmune disease. I've talked to a lot of vets that are like, no, dogs don't get rheumatoid arthritis. Actually, they do. And it's underdiagnosed. But we're a lot of the same hallmarks and the same cell types and the same kinds of things we're seeing in human periodontal disease. I'm seeing in dog periodontal disease. I'm seeing signs of that in cat periodontal disease. In dogs, cats, and humans, Porphyromonas species, not necessarily always gingivalis, sometimes it's absolutely gingivalis, is involved in modifying that host tissue, creating foreign proteins on the surface of our epithelial cells, and then our immune system starts to attack it. Plus, a really awesome paper recently launched showing that this citrullination effect, where an arginine on a protein gets converted to citrulline, which changes the shape of that protein and creates a foreign, like non-self immune response, also not only occurs on the tissue, but also in the biofilm itself. So microbes during a dental cleaning go inside the body and they're seen as foreign, even though we were all tolerized, dogs, cats, and humans, all tolerized to our own microbiomes during immune development. So current ways that are established ways of managing established disease, again, you really want to prevent it, but once it starts, you can manage it. Root planing and scaling, is the physical way, but those microbes start growing back within 2 minutes after you scraped and planed that animal. Antibiotics just take the edge off, but again, disease comes back. We know this from humans and dogs. Antiseptics, which, are in pretty much most of the dental products on the market, just get rid of those good bacteria. And you really don't want those dogs or cats to ingest antiseptics because then it screws up gut health. And then the only other thing is to pull the teeth, right, as the last resort. And I would love for us to be able to figure out how to save teeth more often. But, there's what we're working on is presented herein, where really what we're trying to do is go back to the beginning where the root cause exists. And our goal is to really try to increase diversity and grow the good to manage all that inflammatory process and slow it down or stop it in its tracks. So on the left-hand side of this slide is like your normal aging scenario. You can substitute a dog, a cat, a human, a pig, a horse, where we're born with a fairly healthy diversity. Usually, some rescues are just a mess from birth. Some inbred breeds are also just a mess from birth. But as we age, based on usually diet, stress, environmental factors, a lack of exercise, and a non-diverse diet, you narrow that diversity. And there's usually a magic phase where inflammation starts to creep up. So you'll start to see some disease signs along the way to complete narrowing. So on this spectrum, on the bottom, dysbiosis is like, there's hardly any diversity in that dog's mouth. And we're seeing that like at the age of 5 or the age of 4, where it's totally inflamed. teeth are wiggly already. It's a really sad place to be. In the scenario with treatments, same thing with that dog with healthy diversity. What happens with antibiotics in particular, or antiseptics, which are in a lot of dental chew products, dental treat products, toothpaste in the market, it speeds up dysbiosis or maintains dysbiosis, doesn't correct it. And that can actually, believe it or not, accelerate the disease process. So in our scenario, what we're really trying to do is take a dysbiotic animal and create healthy diversity and re-engineer that oral microbiome. And we're doing that, going back to that slide, the nutrients. So we're really trying to change the whole oral ecology by affecting what the microbes are eating. So we found, and we're just in one example of groups doing this, but we found an inducer that's a fiber non-fermentable that literally inhibits carbohydrate of any kind uptake. And so we're thereby blocking this whole process of carbohydrate eating and acid secreting production, which is pro-inflammatory and feeds the porphyromonas of the world or some of the other disease associated microbes. And then we're stimulating the microbes to really get on that keto diet, break down the amino acids and from the proteins, because every protein is comprised of amino acids, break down that protein, and then that'll alkalinize the environment. And it actually, I'll show this in a minute, it's actually growing beneficial microbes in dogs' mouths, in cats' mouths, in human mouths. And just an example, in a time course with our formulation of this little keto diet, we're putting the oral microbiome on in dogs. You can see that time 0, we're giving it right here. Then there, even 3 hours out, there's a huge increase in unattainable sugars present in the saliva of dogs. And that obviously goes back down because the microbes change and their gene expression upregulate sugar receptors after a single dose. We're having quite a lasting effect. But, that dog's been eating over time. Most importantly, though, over that same time course, the microbes are actually really tearing apart those amino acids and going on that healthier diet plan, as an example, in this mass spec study. Also, you need to be mindful of, we know diet affects biofilm and dysbiosis, but also what's in current products on the market. So this is a dental chew. That's the most popular dental chew in the world. Nothing really on board that's really dental except for the chew part. And you can see this is top down stain. You can see it's a pretty thick biofilm. The thickness we measure here, it's pretty thick. Dalmopanol is a commonly used antiseptic, and a lot of dental chews now are emerging into the veterinary space. You can see that kind of enriches for certain microbes that you don't want, but you can still get thick amounts. Dioxide, which is usually in the water additive format, let's say it encourages certain microbes to overtake. So it skews and actually causes more dysbiosis. This is our Protectin 42 approach. Makes just a thin film of healthy, diverse microbes. Celperidium. We brush our tooth. This is in human toothpaste and in animal chews, and you can see it enriches for anaerobic, resistant gum disease associated pathogens, and then the alcohol water additive, which really accentuates certain gram positives that can survive that onslaught because of their cell physiology. In a study that Animal Biome Animals is 2 snapshots of what they've done for just 5-day change, showing that our approach is having a profound rapid effect on the composition of the microbes in the dog's mouths. You can see these are 2 dogs, Darwin and Charlie. In this case, poor Charlie had 42% of his measurable microbiome was actually porphyromonas, which is gum disease central. And then Darwin had about, 17-ish percent. But within 5 days on that diet plan, despite what the dogs were being fed, we were able to really shrink the harmful gum disease associated pathogens. But if you look up here, you'll see we really started to expand the compartment of diversity, particularly in Charlie's case. Darwin, we did as well, but I think he needed to be on longer than just the 5-day time point to see the really big change. But we did see change. And this is some data from a 30-day challenge we did in collaboration with Animal Biome. You can see in this case, this is Odin, I think he was some type of wolf hybrid, but he had pretty severe gum disease, risk factors on the microbe side, and you can see within 30 days he just had one left. So those are just examples of how just affecting what the microbes can pull in as nutrient sources can have a real significant effect on risk factors for periodontal disease. And these are data from a year-long study what we did during COVID. So all dogs, all comers, all age, all breeds at home being fed whatever they were being fed. And we measured a whole slew of microbes. We're just pulling out the Porphyromonas, the good microbes. The lactobacillus is one example. We showed that over time, our daily diet plan and the drinking water in these dogs that receive the Protectin 42 diet were actually, and this is the microbial diet, we're not treating the dog, actually significantly reduced levels in all the dogs receiving it compared to the control animals. And then more importantly, we started to really grow the good. There were hardly any measurable beneficial microbes that are known to have all these health benefits to them. Lactobacillus species being one of them that are usually underrepresented in dogs' mouths. These days, they used to be more represented historically, but you're seeing we're able to grow them over time because they like proteins. And here's snapshots of the gingival health associated with the dogs that participated in the study. In this case, this is a baseline of a dog in Singapore, small dog breed, had significant abscess and gingival inflammation. And you can see within 2 weeks, and there were no dental cleanings in this because it was just changing what the microbes can eat. The diets didn't shift in the dogs. They never received any dental cleaning or any other kind of supportive care. It's a miraculous shift in what the microbes are secreting and also who's in that oral cavity. And you can see this is a 60-day study, 60-day time point for this dog that had actually pretty severe gingivitis, early stage perio. And you can see we already took that backwards in inflammatory and disease severity in just a few months. And then, as a little teaser, because the mouth is so connected to everything else, and these microbes don't just stay in the mouth, I just want to highlight what we've been seeing. We've now been working with 53 different animals now over the past several years because we've figured out that if we treat the mouth, put them on that diet at the same time that they have their hot spots flare that tend to be resistant and refractory to a lot of the anti-inflammatories and then the antibiotics on the market, you can actually significantly impact hotspots because you imagine these dogs are constantly licking, they're constantly spreading that pathogenic oral microbiome to the skin, particularly in scary lesions. This dog had cellulitis even. You can see where the hotspot started and then it got cellulitis. But we did, daily administration, making sure that dog got the full dose in their mouth every day can really tame that hot spot and inflammation in the skin. So in summary, just really want to highlight that the subgingival microbiome really is where gum disease is initiated and where all the action's at. So it's not really the tooth plaque or the tartar, which is usually a side effect of that. There's a lot going on. So tooth plaque usually grows from below the gum line up the surface of the tooth. So just recognize that there's a heck of a lot going on that you can't even see. It's the significant driver in all of our mouths. If you're a mammal and you eat, very likely those microbes will wind up. We're finding it in the water source. We're finding it in food sources, particularly in raw fed. There's a lot of microbes that are diverse, but there's some of these drug resistant and periodontal pathogens we just need to be aware of. And the microbial metabolites, so what the microbes are eating and secreting and their abundance is really important. And actually, we're finding more important than just who's in the mouth of these dogs and cats that have dental disease. But the good thing is you can prevent. And the best way to do that is to start early, early, early. I put my puppy on at 3 months old, started to really do it. He wouldn't let me brush his teeth, me do much, but he chewed up toys and he gets a bully every few days. And, he's on the water out of urine generating. And I try and diversify his diet as best as possible. He also gets his water dishes washed very regularly. All his toys go through the washing machine with soap. And, that's the best I can do. That exercise him well, make sure he's getting fresh water. I don't use filters in any of his water. because they grow biofilm like you wouldn't believe. And take him to the vet. So far, he's been good at the age of 4. We discussed diet, so moderate that diet, change it up, look at the ingredients, and be very wary. Like rice has a ton of carbohydrate. You're going to really encourage the fungus, the yeast forms of the fungus, and a lot of those gum disease pathogens to really go to town. Minimize the amount of chickpeas and diversify in terms of like herbs. Think about it like in terms of herbs. Green things tend not to have a lot of carbohydrate. Also, change the protein source every day. So, that's the best thing you can possibly do. Perform your routine oral exams and take detailed notes. And this is both for the pet parent and vets. I know time is of the essence. It's hard to just take the time out and just do a good job documenting. Take video if you can just do a panoramic of just cell phone video because our memories aren't that great and we won't notice slight changes because it might slip under our radar. And then limit the there's limited treatment options actually. So everything out there on the market in the human space, which is now being used in the vet space, really has only measured modest benefit. And that's if you do a lot of statistical jujitsu to get it to show significance. But the callback is every 3 months because gum disease is so aggressive. It can be really aggressive based on who's living in that pocket and the tooth pocket and what kind of an immune response is going on and how severe that immune response is. And so, like, I know it sucks, but it's prevention and prevention and prevention and maintenance and maintenance and maintenance and getting aggressive about maintaining the disease state once it starts so it doesn't progress because for every tooth lost, lifespan is lost. And for dogs, it's measured to be about a third of their lifespan can be affected and limited by their disease state because again, the microbes and the inflammation don't just stay in the mouth, they spread to the CNS, central nervous system, the cardiovascular system, distal organ systems, and usually associates with gut disease. So if a dog or cat has gut issues, they're going to wind up with oral dysbiosis too, and vice versa, because it's a tube and everything is connected. And with that, I'd really like to just say thank you for your time today and attention. And I'm very happy to answer any questions you may have about, or just in general, about general practice, things that can be done and implemented. I'm happy to ideate, and you can get a hold of me through info@teefhealth.com. Thank you.